Our HIT solution enables providers to be able to easily access patients' records directly from their phones or tablets. This way, providers can make better decisions and address problems more efficiently. Mobile applications have proved to improve the completeness and accuracy of patient documentation, allowing healthcare providers to be more efficient in their work practices, and has helped streamline workflow and increase the productivity of healthcare professionals. The use of the mobile device has been shown to provide healthcare providers with numerous enhanced efficiencies, including increased quality of patient documentation through fewer errors and more complete medical records, more rapid access to new information, and improved workflow patterns. The solution is a mobile application. The app is intended to be downloaded on mobile devices to make it convenient for providers to access medical records while on the go. The rapid integration of mobile devices into clinical practice has in part been driven by the rising availability and quality of medical software application, or apps. Apps are software programs that have been developed to run on a computer or mobile device to accomplish a specific purpose. Faster processors, improved memory, smaller batteries, and higher efficiency open sourced operating systems that perform complex functions have paved the way for development of a flood of medical mobile device apps for both professional and personal uses. Primary users of the app are physicians, physician assistants, nurse practitioners, nurses, medical assistants, and patients. The patients benefit from the users using the app for the following functions: information and time management, health record maintenance, access communication and consulting, reference and information gathering, patient management, patient monitoring, and medical education and training. Our HIT solution provides physicians the access they need to patients' information when they are not in the office or by their laptops. Our solutions make accessing patient medical records much easier for physicians or other healthcare professionals, and it enables them to control their patients' care much more efficiently. Physicians have reported that the use of a mobile application for retrieving information from a drug database led to more efficient decision making in patient care. Mobile devices have been found to cause a significant increase in the average rate of electronic prescribing from 52% to 64%. Studies that investigated patient record maintenance and revision found that more patient information was documented when a mobile device was used, reportedly because of the ease of use in comparison to paper charts. The research found that 86% of healthcare professionals believe that health apps will increase their knowledge of patients' conditions. What's more, 96% of users think that the health apps help to improve their quality of life, and 72% of healthcare professionals believe that health apps will encourage patients to take more responsibility for their health. Half of healthcare professionals think that apps will increase the efficiency of patient treatment, and 46% believe that they will improve their relationship with their patients. Healthcare professionals see the greatest benefits for helping patients with chronic diseases. 76% believe that they will help patients with chronic diseases, such as diabetes or heart disease. The Federal Trade Commission also has jurisdiction over health data breaches when the entities involved are not HIPAA covered entities. The Federal Trade Commission has already been active, taking enforcement action against several mobile health app marketers that have not met the requirements of the FTC. The Federal Drug Administration has the responsibility of regulating equipment or software intended for use in the diagnosis or treatment of a disease or other condition. Jay Bluebird, a 58-year-old Caucasian male, has called the answering service with complaints of a runny nose and watery eyes. He states that it just started a couple of days ago. I received a page from my answering service this evening because they had received a call from Blue Jay Test. Blue Jay called because he is having a persistent, non-productive cough and allergy symptoms for the last week. These symptoms started after the date of his last office visit, so these symptoms and issues were not addressed at his last office visit. He is requesting some medication that can help him with these symptoms. Upon pulling up his chart in the mobile app, I would like to see what was done at his last office visit. So I'm going to review the encounter of the office visit with Dr. Template, one of my partners. So as I can see here, he was treated for chief complaint and heart failure, which does not address his allergy symptoms. Most importantly, I want to review the progress note to see if there's any important information that I need to know before prescribing a new medication for the patient. And I would also like to review the vitals. His vitals look good and everything looks to be within normal range. I would like to prescribe him a new medication to take for his allergies. So after reviewing his medication list, I can see he is on nothing that would help his allergies, so I'm going to start a new medication order for a prescription Flonase, which is a nasal spray, which will help alleviate his symptoms. I would like him to take 2 sprays in each nostril daily. I would like to see him in the office for follow-up in 1 week, so I'm going to give him a 7-day supply. I'm going to give 0 refills at this point because I have not yet physically evaluated him in person. And I'm going to accept and sign the prescription. I now need to write a note in his chart explaining what I did and why. I am writing this note because on Monday, when we are back in the office, our front desk staff will call the patient to schedule a follow-up appointment. The medication has been prescribed. I have written a note in the chart, and we have completed everything I need to do to get Blue Jay feeling better at this point. The last step of this encounter is I'm going to call him and let him know what I have done. The phone is ringing now. I have been sent to voicemail. Beep. Hi, Blue Jay. This is Dr. Britton calling to let you know that I've received your call from the answering service about your allergy symptoms. I went ahead and I sent a prescription for Flonase over to your local Walgreens. Should be ready for you to pick up in about a half hour. I would like you to follow up with our office in 7 days to check on your symptoms and to see if any further medications are needed. I will have my front desk staff give you a call Monday morning to schedule this appointment. If you have any questions, please feel free to give me a call back. Thank you. The future trends in mobile health apps include prevention and management of chronic health, patient care management and compliance, support for caregivers, and to promote better communication among patients, physicians, and other resources.